Paul, we've talked a lot about the big squeeze, and one of the factors is this impending clinical tsunami. So what do we mean by that, and what's the impact going to be?
Yeah, I think the impact is going to be twofold. One, it's going to be a lot of deferred sessions of care that people put off when they didn't want to travel or introduce themselves into the clinical environment. I think the second is COVID, long COVID specifically, and COVID sequela, meaning the episodes and issues coming out of COVID, specifically with regard to cohorts of chronic conditions in patients. I think you're going to see a lot of those patients, and the impacts of long COVID have accelerated and exacerbated some of their chronic conditions, which is going to cause more episodes of care, more frequent care, and is going to impact negatively the throughput and patient access in the brick and mortar clinics.
We know as a country there are lots of opportunities to improve chronic disease management, and it seems like with this impending tsunami, we have to get even better at it. So how should we be thinking about that?
I think one of the things that most organizations really need to think about is starting to implement those virtual care programs. They really need to think about how they see patients without dropping their quality of care differently, that aren't as tied to the brick and mortar clinic as they have been in the past.
So health systems are facing a number of problems all at the same time, including the clinical tsunami and EBITDA, which has been an all-time low for a number of years. How can they think about an approach to solutioning that addresses many of these factors at once?
I think they need to think about solutions that can at least address three factors. One is access. Freeing up space in brick and mortar clinics to see different episodes of care is going to be critical, and I think they can do that with a virtual care solution. And they should start with those cohorts of patients that are those chronic conditions, because there is a lot of scheduling of patients that happens on a pure timing episode versus the actual care needed to be delivered. And so I think these systems can be set up appropriately to effectuate access. I think technology, again, to talk about the systems and the technologies and the efficiencies gained, you can do multiple things with them. You can see patients virtually, you can monitor patients via telemetry and devices through gateways and monitor the exceptions to their care and to the telemetry data that comes in, instead of seeing them sequentially via that scheduled episode of care. And then lastly, reimbursement. A lot of these technologies, as they create these efficiencies, can also track how patients are seen and can collect the data required for proper reimbursement for these patients. So not only will you free up space in your clinics to be able to see additional patients, but you'll be able to take care of that chronic condition cohort of patients and get reimbursed for it from a virtual care perspective.
That's great. Thanks for sharing your perspective, Paul.
No, thank you.